We have a tribute now to the lady with the lamp and the legacy that she led. Joining us as we explore why Florence Nightingale still inspires nurses today, how the profession is involved, and what her vision means in our modern healthcare world. Joining us this morning to tell us more is Dr. Mary Ellen Costurco, Doctor of Nursing Practice, Executive Vice President and Chief Nursing Officer at Hartford Healthcare. Doctor, thanks for being with us. Can you start by telling us why Florence Nightingale, which is a legendary name, is still such a powerful symbol when we talk about modern nursing here in 2025?
I would love to, and thank you for the invite today. She truly was and is the pioneer of nursing. She started back in a day when she was the lady with the lamp, as you referred to her, in the Crimean War, and going to soldiers at night with lamps in terms of healing and caring. But even more important than that, truly, was the education that she brought at a time before education was really standardized, using databases, statistics, graphs, and really studying how to better take care of patients and decrease mortality rates. So in a time when we didn't have all the modern day things that we have today, she brought that to the bedside and to the patients and saved many lives.
I know it's hard to quantify something like this, but how has nursing evolved since Florence Nightingale's time? And what do you think she might think of the healthcare system of today?
Boy, would I love to talk to her today if that was ever possible. But, all the things that she brought were kind of the underpinnings, if you will, of nursing. We now have names for them. So the education that she brought, she opened the first school back in 1860 in London, the first school of nursing for standardized education. We now have educational programs all over the United States and beyond. She has brought what we now refer to as evidence-based practice. So truly through clinical trials, through studies, through research, she did that all on her own with no help. And we now refer to it as evidence-based practice, and we build the care that we provide to patients off of that. We now refer to something as patient and family-centered care. She did that, doing holistic care, not just the body, but the mind and the spirit. So all of the theories that we work on today in the practice, she was doing without even calling it a name. And we have carried that forward. And I think she would be humbled and pleased to see that she still remains the pioneer and the giant shoulders that stand before us.
Talking about your own personal journey, what inspired you to become a nurse, and how does Florence Nightingale's story kind of resonate with you?
So I knew from a very young age that I would be a nurse. And certainly by the time I entered high school, it was abundantly clear to me that it was my calling and that I would follow it. Having taken care of loved ones and friends who had had some incidents that required care, I knew that I wanted to care for and heal patients. And I think in terms of her journey and how it might mimic mine a little bit is I've become a lifelong learner. My bachelor's degree, my master's degree, and my doctorate degree. Opening 2 schools of nursing in the state of Connecticut, University of Bridgeport in Eastern Connecticut, and over a dozen other programs, building nursing programs with our academic partners. So the love of lifelong nursing has been part of my journey as well.
Doctor, thank you so much for your time this morning, and thank you also for all the great work you do.
Thanks for everything, and happy Nurses Week to all the nurses out there. Thanks for all that you do. So appreciative.
Very good.